Hello, I am Dr. Swathik Shetty. I am a consultant neurosurgeon at Manipal Hospital, Old Airport Road, Bangalore. Today we'll speak on awake craniotomies or awake brain surgeries. Awake brain surgeries are surgeries which are done for tumors which are located in eloquent cortices of the brain. That is, critical areas of the brain which are concerned with either speech, movement, sensation, vision. So whenever tumors are located very close to these areas, it is important that we are able to remove these tumors safely without leaving any deficits to the patients. So whenever we are faced with these tumors, what we do is first we do a thorough pre-op evaluation in the form of an MRI. We do special MRI sequences like the functional MRI, fMRI and DTI, which tell us which are the functional areas of the brain and how close is it located to these tumors, and also the fibers, the important fibers which are traversing the brain. So whenever we do awake craniotomy, the day before the surgery, we take the patient to the operative theatre. We acclimatize them to that room. We show them the drill and we show them various equipments, the sounds which can happen come in the OT. So just to make them more comfortable and allay their fears on the day of surgery. And on the day of surgery, what we do is we anesthetize the scalp by giving a ring block. Once we give a scalp block, then we do a craniotomy. We open a part of the skull, we open the covering of the brain. Then the first thing we do is we map the brain areas, what is called as brain mapping. Intraoperative brain mapping helps us to locate all these important areas. So as we are stimulating the cortex, we assess the patient's speech. We look at any contractions which are occurring in the hands and legs of the patient, or if there is any facial deviation. All these help us map the brain areas and tell us where these important functioning areas of the brain are in relation to the tumor. Once we map the brain, then what we do is we internally debulk the tumor. When we are debulking the tumor, we do something called as a subcortical stimulation to know how far are we from these important fibers which are traversing very close to these tumors in these eloquent cortices. So this helps us to preserve these important fibers and not destroy them, and not to leave the patient with any post-operative deficit. During tumor excision, we constantly are interacting with the patients. The other team on the other side, they are assessing the patient's speech, the patient's hand and leg movements. So all this is being done so that we get a real-time feedback when we are removing the tumor, and we can remove these tumors safely. So by using these advanced intraoperative neuromonitoring techniques, neuronavigation systems, and some equipment like CUSA or the cavitron ultrasonic aspirators, we can effectively and safely remove these tumors without leaving any deficits to the patients.